Tom, can you start this video letting the audience know who you are along with your title and background?
John, I'm a retired physiologist from the University of Colorado Medical School. Worked there for approximately 30 years. Retired about 10 years ago. I have a PhD in physiology, and I've been working in blood flow changes throughout my whole career.
Can you highlight some of your academic and professional achievements for the last few years?
I've been very lucky in my life. When I graduated with my PhD, I went to Duke University for about 4 years on a postdoctoral fellowship to really get detailed research background and thinking in the area of kidney physiology and kidney disease. And then Colorado recruited me, and I spent about 30 years, as I said, doing research in kidney disease and blood flow and training young people to become medical students.
Tom, over the last few years, you focused on some really exciting new technologies. One of those technologies being a project you've been collaborating on. Can you talk about this new emerging technology for the human body?
John, my interest in blood flow led me about 15 or 20 years ago to examine the effects of infrared light therapy. Some people think it's snake oil, but really it has a strong background. Infrared light therapy increases blood flow at any site in the body that it's applied to. And the beauty of this is we've been able to see research efforts in healing wounds that are difficult to heal, for example, in a diabetic, hopefully to prevent amputations or at least decrease the incidence. Improving skin blood flow in other areas of the body as well, and most recently, looking at changes in blood flow to the brain. I've been fascinated by this advance in science.
Tom, has this been taken up in the broader medical community with respect to some of the target areas that you just talked about?
It is. It's gaining greater acceptance in the last several years. The beauty of it is it's a non-invasive, drug-free way, working in concert with physicians and pharmacology and pharmacists. We've been able to see an improving outcome for patients by increasing the blood flow.
What was the moment that really energized you to approach this particular field, given your background? And what was the tipping point to say, hey, this is really interesting to me, or motivated you to get into this particular area?
It's a great question, and it was almost serendipitous. I knew blood flow increased, as many of my colleagues did, that blood flow increased when you applied infrared light to the skin. The question was, what was causing this? And about 1993, a paper from Duke University suggested that red blood cells actually carry a compound, a gas called nitric oxide. And it turned out that the link was that the infrared light would release the nitric oxide from the red blood cells at the site of treatment. What is nitric oxide? In 1998, 3 Americans were given the Nobel Prize for their discovery that nitric oxide actually dilates blood vessels and improves blood flow. So it was full circle. Light increases vasodilation or blood flow. The light increases nitric oxide causes vasodilation. So it was, as I said, almost serendipitous when you put these together. But the beauty of nitric oxide is that it can help increase blood flow at any site a physician, physical therapist, chiropractor wants to increase that for his patient's benefit.
When I'm at home, my TV's remote control uses an infrared beam. And I know fast food restaurants keep their French fries warm with infrared lights. So is that the kind of infrared light you're talking about?
It's similar, John, in a way. This is called near-infrared light. It's very close to the red wavelength that you and I can see of red sweater or red tie. But it's just outside the human body's ability to envision the light. So it's essentially invisible. There is far infrared light that you see in saunas and even farther into wavelengths that are similar to radio waves. But this near-infrared light is a very unique wavelength that's used for healing, if you will.
So when you're talking about the blood flow increase, it sounds like that could be something applicable for a concussion or head injury or things like that. Is this increased blood flow one of the key reasons that clinics should take a look at this technology?
Near-infrared light has been used on the human skull everywhere from pediatric patients in the intensive care unit up to adults with certain injuries in the brain, strokes, concussions, and things like that. And it's been used for a long time, but from a diagnostic standpoint, the question raised by scientists and physicians was, if you shine a little bit of infrared light into somebody's skull and then have a detector nearby, you can detect whether the blood flow is normal, too low, or in fact too high. So it has a long history for detecting blood flow changes. What has not been used or really adapted is the effect of near-infrared light to actually repair damaged tissue within the brain by increasing oxygen delivery and vasodilation to see if you can help heal the damaged areas in the brain.
So my understanding is that you've collaborated with a team at Serascan, a comparative imaging company that has worked with 2 military soldiers that had some brain injury suffered during conflict. What has your participation been, and what have you seen with the soldiers?
Well, I've been fascinated by your observations at Serascan. The 2 gentlemen that you mentioned had significant injury to their brain detected by Serascan's imaging. They underwent a series of exercise therapies and near-infrared treatment, and when you re-imaged those brains, you found a remarkable decrease in the amount of damage, if you will, to the brain. And attributing this to infrared light therapy was an easy guess for me. Now, we haven't done any placebo patients yet, but I'm hopeful that what you've seen is a direct relationship to infrared treatment to help increase blood flow, oxygen delivery, and to those areas of the brain that were injured and damaged. The brain has a remarkable capacity to heal itself.
Now, are there any harmful side effects about anything we've talked about today?
Not really. Infrared light has been used for many different conditions in the human body.
So we're really only talking about side effects in regards to what we've discussed today. Is there anything we should be worried about in terms of working with patients and potential side effects? Can you get too much of this? Is this too much of a good thing? Are there some other problems that could come down the road, to your knowledge?
John, really, I don't know of any serious side effects to infrared light therapy. However, I think you and your team are wise to collaborate with radiologists and have an MRI to rule out any potential blood flow changes that might be due to damaged vessels that would cause a bleed, to look for any potential sites of tumors in the brain before we treat with infrared therapy. So you've gone through a series of very careful analysis of these subjects. When we start to treat them with infrared therapy, there shouldn't be any negative side effects.
With these characterizations of vessel dilation, it sounds terrific that we could improve blood flow to an area that might be damaged, but do you foresee an ability to team up with other kinds of therapies that whereby 1 + 1 might equal 3, such as pairing the dilation caused by the infrared light with some medical devices? Some medical professionals have proposed creative interventions with these injuries.
It's a great question. One of the most exciting things that people have used for decades is hyperbaric oxygen therapy. It started out being used in the Navy and for divers for decompression sickness. It turns out that the theory is that if you can put somebody into a hyperbaric oxygen chamber and increase their body's level of oxygen, that tissues that were damaged or injured can heal faster. We're hoping to launch, in conjunction with Serascan, the use of infrared therapy and hyperbaric oxygen together. And think of it this way. If the blood flow or the blood vessels in a damaged area of the brain are not there, even if you increase hyperbaric oxygen levels in the blood, it's not going to get to the site that it needs to as easily as it might if you could dilate the blood vessels in that area. So the exciting thing is about other interventions in conjunction with infrared light therapy. As I mentioned, some of the drug therapies might actually get to sites where they're needed in the brain.
One of the things that was reported by the first two soldiers that began this therapy was that in a relatively short period of time, 2 weeks, both were indicating that they had regained the ability to sleep through the night. Additionally, both soldiers had reported some migraine like chronic headaches from the initial concussion. However, both also discovered after that 2 week period the headaches seemed to have diminished. The treatment had given them a better quality of life. Do you have any thoughts about that?
Well, certainly the headache issue is one that I think I can speak to. Headaches are sort of a painful condition, and nerves in the body and the brain as well need good oxygen in order to function well. Think of a rubber band around your finger. Put it on, leave it on for 10 minutes, it begins to throb and hurt. The message that the brain is getting is that that finger needs more blood flow. So if pain goes down in the first couple of weeks of infrared therapy in these warfighters, it may signify the early event, which is increased blood flow and oxygen delivery to sites in the brain that would otherwise exhibit painful conditions.
One of the things that really seemed to surprise the medical profession was the fact that with the first patient, after 9 months when the therapy ended, it seemed to be a treatment that sustained itself. In other words, it looks as if the treatment may have been permanent in nature. Do you have any thoughts or observations as to whether treatments need to be ongoing or a maintenance kind of thing? Or is it a short-term event? In other words, it was fixed and the symptoms will not come back. What are your thoughts around what you saw with the initial patient?
Well, I know you're excited, and I am as well, about what appears to be the sustainability of the therapy. However, I think we have to be cautious at this point. The first patients that were studied were treated several times a week for the first several weeks, and then the treatments dropped off to once a week near the end. The question, obviously, as a scientist I would have is that if we kept up the several times a week treatment all throughout this 12-week period, would we see even a greater improvement in blood flow, a greater sustainability, and down the road, those kind of studies will have to be done, John.
Can you give us an idea about the available research that might be out there? And are there any institutions pushing the envelope here with credible studies done or credible published articles?
John, there's some exciting things coming out of Harvard, Boston University, even the University of Wisconsin. Those three places have photonic, if you will, institutes in their medical schools and their institutions. They are looking at treatments of using near-infrared light therapy on the brain in areas of concussion and even several war fighters. So what Sarah Scan and this team is doing here in Denver really parallels what's going on in the Northeast and the Upper Midwest at several prestigious institutions.
As a professional who has really dedicated a lot of his research and application on the human body, what might you predict if you had to speculate on the potential for this treatment over the next 2 years? Of course, understanding that there is still a great deal of scientific study to be done, what might your message be to the public in regards to saying, hey, in the next couple of years, you should keep your eye on this?
I'm excited. There are many conditions in which changes in blood flow have been implicated. Medical research has shown that things like PTSD is associated with a change in blood flow to the thalamus. The question is, could near-infrared light therapy be used after SERAScan and SPECT imaging have identified actual changes in the thalamic area of blood flow? So that's one I'm excited about. Others include changes in blood flow to the frontal lobe, which apparently is a significant contributor to ADHD. Could we use near-infrared light therapy on blood flow changes in the brain of people with ADHD? Would it be safe for children? These are all the kinds of questions that come up. And the third of interest to me is that Alzheimer's patients appear to have decreases in blood flow to their brain when they're fully diagnosed with Alzheimer's disease. Well, I think of those people as like you and I, which have normal blood flow at some point in our life, and it must have gone down over time. Could we intervene in people who are diagnosed with early Alzheimer's disease using infrared light therapy and SPECT imaging as appropriate to delay or prevent even Alzheimer's disease from being as critical a problem as it is?
So initially, what we focused on here is on a moderate traumatic brain injury group in the military. However, I believe you're inferring that there may be broader applications for the general population, such as the geriatric and pediatric worlds, if I understand what you're saying correctly.
That's correct. I think it's wide open. Infrared light is a non-invasive, drug-free way cleared by the FDA for doing two things: increasing circulation and reducing pain. And that clearance allows physicians to begin to examine, if they think outside the box a bit, these other areas that I just mentioned.
Regarding the FDA, it sounds as though the treatment you're implementing has at least gotten an initial foothold within the FDA relative to the processes that are there. I know there's going to be more that needs to be done, but we're not talking about something that's totally experimental in the eyes of the FDA.
That's correct. The beauty of the FDA clearance is it allows any physician to use a medical device or a medical modality as he or she sees fit, even though there isn't a clearance for traumatic brain injury, a specific clearance for Alzheimer's disease or ADHD or migraines. The beauty of it is that physicians have that luxury after the FDA clearance is there to go forward. And I'm excited about the possibilities for the humans that you and I deal with in the military, as well as others.
It appears as though this can be made available to the general public. In other words, a patient might not necessarily need to go to a high-end clinic environment. In order for us to be able to work with these patients, it looks like this is something that may be able to be delivered to the masses. Is that a fair comment?
Well, I think it's a fair comment. What I like to see first over the next year and a half or so is for psychologists and psychiatrists to begin to investigate the use of near-infrared light therapy on the brain for some of their patients with controlled and very detailed and very controlled clinical studies and clinical protocols. However, at some point, certain people will need maintenance therapy. And for, I guess, over a decade now, near-infrared light has been used for people with chronic conditions, not in the brain, but in, say, diabetes, where the circulation to the feet causes you to lose sensation, you have trouble walking, your balance goes off, you may fall and experience a fracture. So infrared light has been used as sort of a 3,000-mile checkup for many, many diabetic patients over the last 10 years to keep them in a relatively good blood flow to their lower legs so they have improved sensation, less pain, less trouble walking, and better balance. And it's hard to say that it's prevented some of the falls and catastrophes in diabetics, but I think it's been out there.
We covered a lot of things here today. I'd really like to again re-emphasize the acceptance of this treatment at the broader level, the broader medical community, and exactly at the 30,000-foot level. What's really going on here with the use of this technology?
The general medical community has adopted this technology for several areas. Knowing that infrared light therapy, near-infrared light therapy will increase blood flow, physicians have begun to use infrared light therapy in conjunction with antibiotics, for example, to get to an infected wound. If you can increase blood flow using light therapy, the antibiotic gets to the infected wound more easily. So that's one area that's gained great acceptance by the medical community. Others have thought that if you can increase blood flow to the lower extremities, for example, you can help people to walk better and maintain better balance. So there are conditions in which the broader medical community looks down at infrared light therapy and says, this could help my patients in my particular practice.
Now, with respect to the brain, along that same line of thinking, a conclusion can be drawn then that perhaps the treatment can help out in terms of the concussion, mild or moderate traumatic brain injury in the impacted area. Is that correct?
Oh, yes. Light therapy does penetrate through the skull, near infrared in particular. It goes to a fair distance within the skull. In fact, it's used to monitor how much oxygen is flowing through the brain at a particular time. This is especially important in pediatric patients, in patients with concussive injuries, others with things like PTSD or Alzheimer's disease. Many of these patients have low blood flow in the brain, and it's been diagnosed by near-infrared light therapy, which is applied to one site on the head, and then a detector is placed close by. Knowing that you have a deficit in blood flow in the brain then allows a physician or a pharmacologist or a neurobiologist to begin to think about how can I use this technology, and knowing where the damaged brain areas are, to get more drugs to that site or to improve the blood flow to that site using various technologies.
So one of the things that was exciting to us, and I'd like to get your comment upon, is the difficulty of determining whether a subject really has a traumatic brain injury, and if there are chronic situations that resulted from a traumatic brain injury, and has the imaging world come up with new ways to make that happen? From a doctor's perspective, how to verify if there has been a concussion event, and are there chronic issues associated with that? Is this real additive to the therapies we're talking about today?
I think it's very important that any physician or any private company trying to look at those people with concussive injuries know how severe the problem is. If you don't know how severe it is and where it is, it's unlikely that you could go forward with any kind of therapy to try to help someone. So I've been impressed by looking at the SaraScan imaging technology that SaraScan has provided, which shows, I think, the chronic nature of sustained injuries within the brain 6 months, a year, 5 years after that injury had occurred. The beauty of what these first two warfighters and the treatments that we've instituted in them with near-infrared light therapy has shown is that even though the injury happened several years ago, within 12 weeks, major changes in blood flow within the brain are documentable. And associated with this are improved sleeping habits, better memory, less social disruption. There are a lot of positive things that I can't believe haven't been the result of better blood flow.
I really want to thank you for coming in today. It's great to learn what you've spent such a large amount of your professional life helping further, and we do appreciate it.
Thank you, John, very much for having me.